One more thing about healthcare. I've got a daughter who was cancer. She had a baby about 4 months ago. She decided she loves being a mother so much to resign from her position as a teacher. Guess what? She can't get insurance because she has a pre-existing illness. She's been cancer-free for over 15 years. But the cancer also brought on diabetes because it damaged her pancreas. Pre-existing illness. And the insurance companies tell her to take a hike. And I don't care what anybody says. She didn't go out looking for it. She didn't deserve it. But she's getting screwed in the long run because they won't cover her. Unless she goes back to work and she's under a big group insurance policy. Why? What did she do to deserve this type of treatment from supposedly the greatest country in the world?
Well, I do think it's one of those things that we do have to, we're a compassionate nation. We need to take care of people with pre-existing conditions. The lady talked about it as well. We can do that. I mean, I agree with you too. We're America. We can figure this out. Somehow we've got to come together. We fall into these traps of us versus them, throwing stones. I just don't feel like it gets us anywhere. I mean, I think we say there's a group of people, I don't know, some would say maybe 15% of the population, some might say 7% of the population have pre-existing conditions where they can't get insurance. We can figure that out. I know we can. Now, I also know, though, for the other 85% of the people, that they like kind of the system that they have, to be able to see the doctor that they want to see, to be able to get in quickly, to be able to see them, to have tests that can be performed. They just want it to be more affordable. So we got to address the cost for the rest of them. But then for those that truly are uninsurable with pre-existing conditions, we've got to have a system in place. And I know we can figure that out. But somehow we've got to get together.
All I would like to see is something, no matter whose healthcare system finally gets adopted, if anyone does, something about if you have a pre-existing illness, you cannot be turned down for insurance. That's what I want.
That was passed. You voted to repeal it.
Yeah, right.
Well, let me tell you real quick on this health care bill. It is unraveling. There's been 4,000 waivers already that the administration has granted from that. The 1099 provision has been removed from it, which, again, I supported removing that. Over 4,000 waivers. So, you know what? Some part of this bill is going to stay. I think this is part of it that's going to stay. The Senate's not going to pass repeal.
So why did you vote for it?
Because the immediate next vote that I took was, now let's fix it. Let's go in and fix it. We all say, there's parts of this that I think did not address the real problems.
Which bill was
parts
that?
That can fix it.
Which bill was that you voted for to fix it?
The very next day.
What's the bill number?
I'll get it to you. So if you can give our people the number, I can give you the bill number the very next day.
I don't recall reading that.
Yeah, it was exactly the next day after the repeal vote. So I can get you that. Yes, right here, in the red first.